The last and the oldest drug class that I want to discuss for the antidepressants are the monoamine oxidase inhibitors. They are abbreviated as MAO, for monoamine oxidase. And that's actually an enzyme. So if you're looking at our nerve terminal here, there are mitochondria. I'm going to just draw here some mitochondria. And they have this enzyme MAO, monoamine oxidase. And what this enzyme does is metabolizing monoamines. So monoamines like dopamine, norepinephrine, serotonin, they are going to be degraded to inactive metabolites. Now, if we are inhibiting this enzyme monoamine oxidase with a monoamine oxidase inhibitor, we're going to have more availability of norepinephrine and, let's say, serotonin, because there's less degradation, and that's going to help with major depression. There are actually two isoforms. There's MAOA and MAOB. So A is more responsible for degrading norepinephrine and serotonin, and B is mainly responsible for degrading dopamine. So now it turns out that these old antidepressants are drugs like phenelcin, and that's the only one that I would remember. Phenelcin. I mean, they are fairly old, very few uses right now. It's more used for treatment-resistant depression. That means you have already tried, let's say, 2 or more drugs with a patient and still nothing works. Then monoamine oxidase inhibitor would be something to think about. And one example is phenelcin. And this is a so-called non-specific monoamine oxidase inhibitor. But we're mainly thinking about monoamine oxidase A still. And we're going to get mainly norepinephrine and serotonin, which are also the neurotransmitters that we discussed before. And adverse effects, as we discussed, would be related to an increase in norepinephrine and increase in serotonin. I still want to mention, because it's going to come up, particularly when we discuss Parkinson, that there is a famous drug, it's called selegiline, which is an MAO-B inhibitor. And is mainly responsible for degrading dopamine, and that should make sense why we use it for Parkinson, because in Parkinson we lose dopaminergic neurons, so we want to boost dopamine, and we can do so with selegiline. But selegiline is also available as an antidepressant in patch form, so that's still something you may come across. So phenelcin as the traditional MAO inhibitor, but you're going to need to know anyway selegiline for Parkinson disease, PD treatment. So I just want to mention that here as well. Now, a couple of more words about adverse effects. So if you're now sticking with phenelcin and say we're mainly going to affect norepinephrine and serotonin, we can predict all the adverse effects that we already talked about, so I'm not going to go over them again. Now for this monoamine oxidase inhibitors, I want to talk about one other thing that comes frequently up, and is also part of the reason why they are not used so much anymore. They have a very famous drug-food interaction. So that's something that is obviously less wanted, because it's always harder to control patients' food than to control patients' other medications. So, and drug food is just also less common than drug-drug interactions. So what is a drug-food interaction? Well, the drug-food interaction is with so-called tyramine-containing food. Tyramine-containing. So where do we find tyramine? In all kinds of fermented products like aged cheese, aged wine. So that's something where you need to think about in terms of fermented products. Fermented products. aged cheese and wine. So really the good old cheese, not the one that you get at Costco that probably never saw a cow. So really good old fermented cheese. Now, what is the consequence? So tyramine is a indirect sympathomimetic. So remember, sympathomimetics are drugs that mimic the sympathetic nervous system, and indirect, so they lead indirect to more norepinephrine. So now, what's going to happen here is that tyramine is also degraded by MAO. So tyramine is also degraded by MAO to inactive metabolites. So if you have this MAO inhibitor on board, let's put this in here, MAO inhibitor, you're gonna get more tyramine. And tyramine is an indirect sympathomimetic, so we're gonna have even more norepinephrine. So what could be the consequence of this? It's gonna be a hypertensive crisis. And so really high blood pressure, life-threatening, elevated blood pressure. And that's something that is also tested a lot on board question. So the typical scenario is somebody with major depression goes to something like a wine and cheese event and then consumes 2 glasses of good old red wine and some cheese and has this hypertensive crisis. Which medication was he most likely treated with? It's probably an MAO inhibitor, things like phenelcin. And it's also more likely with this MAO more A inhibitors than the other ones that we're also going to discuss in Parkinson, like the MAO-B inhibitor. You could also still see it, but you need much higher concentration to get to a hypertensive crisis. So that's really something to watch out for, and also to educate the patient. They should consume very little of this fermented products when they're on an MAO inhibitor. The last thing I wanted to mention is that these MAO inhibitors are actually irreversible. So this is an irreversible inhibitor. So what is the relevance here? Well, if you have somebody on an MAO inhibitor, for example, and want to switch to another medication, you need at least a 2 weeks washout period, because it's going to take a while till you regenerate monoamine oxidase. And if you do the switch too quickly, you can have high levels, let's say, of serotonin, because serotonin is also degraded. And let's say you make a switch from an MAO inhibitor to an SSRI, and then you're already having here high levels of serotonin. You don't wait till the enzyme is regenerated and switch immediately to an SSRI. You could trigger something like serotonin syndrome. So it's very important to do a 2 weeks washout period before starting new drug. And that has to do because it's an irreversible inhibitor. So that's something else that you need to consider when working with this drug.